Thank you, Mr. Simon. I would like to welcome all of you here to this Board of Health meeting, September 1st, 2022 at 4:33 p.m. And I will turn the meeting to the chairperson, Dr. Brophy.
Thank you, Dr. Monfort. So I'd like to call the meeting of the Board of Health to order. First item on the agenda is approval of the minutes from August. Mr. Fisk, any changes to the minutes?
No changes, and I accept them as
okay. So all in favor? All in favor?
Aye.
Aye. Okay.
Aye.
Next item on the agenda is special item to be heard by the board is regarding the life science bio-ready community adoption guidelines by the NIH and regarding recombinant DNA. Is Mr. May and Mr. Fay online?
It would be just myself, Mr. Fay.
Ms. Fay, okay, great. So I think we've been discussing this for a bit, and last time sort of left the meeting with some understanding that trying to find out the relationship or what information or what the boards of health in other communities were doing as far as guidelines for following to make sure that there was compliance with the NIH guidelines. So I don't know if you have any information to get back to us about that or a report about that.
Unfortunately, at this time, we do not have additional information. I am speaking with a few individuals from Cambridge Health Alliance who is linking me up with different consultants who work in this field. The boards of health themselves, or I should say the departments of health themselves, are a bit cagey and generally just point us to their regulations and they don't speak on, the day-to-day intricacies of how their board operates. Yeah. Though I am expecting to hear back from this consultant group pretty soon. I had the Cambridge Connect ping him so that he would hopefully respond sooner rather than later.
Oh, that's great. Would it be helpful if members of the board attended a meeting with you, to have a discussion with them? I'm certainly open to that possibility that Dr. Montessori, we certainly could set up a meeting of some sort so that the board members could discuss this with that group.
I think that would be very helpful, seeing as you probably speak the same language, so to speak.
Yes.
Whereas I am less educated in the health world.
Yeah, so I think, rather than having you as sort of a third party in between, I think it'd probably be the best action would be for us to set up a separate meeting for them to come and inform the board, give us information on I've read the guidelines, I understand them. The issue is what actions need to be and how boards of health should be monitoring. These companies would be following guidelines, but everybody is inspected. What would the board be expected to do, both in approving them and then in monitoring them as once they open? So I think that it would be very helpful to have them as an advisory group to us. That'd be great.
Absolutely, and other boards and or departments of health may be a bit more receptive if they know that another board is seeking some information as opposed to a planning professional.
Got it. Okay. Yep. Great. Okay.
So I can link up with Eno on that, definitely.
Yeah.
Okay.
So, and we can set up a special time. I certainly would want Dr. Andres to be able to join, for that meeting. It would be important. So between Mr. Fisk, myself, and Dr. Andres, a time to have that discussion. So.
Yeah, and on that note, Dr. Brophy, I wonder if maybe Mr. Fay could probably send us a few tentative dates, and then maybe you directors could decide which one works best for you, and then I will finalize with them.
Yeah, that'd be great.
Okay.
Wonderful. Mr. Fay, any other information that you'd like to bring to the board at this point? Or
nothing new today, unfortunately.
Okay, wonderful. All right. Well, it sounds like we have a plan and we are moving forward. We're hoping to, I believe you had wanted this by the end of the year. And I think, we've made a lot of progress to this point. I think it's now getting down to to the nitty gritty of
That's
how so the board would operate. So thank you for coming, and we look forward to having that meeting, and hopefully at the next meeting we can have some action items available. Okay.
absolutely. Thank you very much. Thank you.
Okay. Wonderful. All right. So I believe one of the next items was item to be heard by the board was from the McCluskey law firm regarding a tobacco permit, but I believe that's not going to be discussed today, so that's going to be removed from the agenda. There is one other item that has been brought to us from Jacob Driscoll Engineering, requesting a variance for a dumpster, which is not on the agenda. So in order to add that, Mr. Fisk, need a motion to add this to the agenda that we can vote upon. So
I make a motion that we add that.
okay, so all in favor? Aye.
Aye.
And
Mr. Jim
is there
Barish,
someone?
is that how you
Okay.
pronounce it, Mr. Barish?
Yes, thank
Okay.
you.
And you're representing the Jacob Driscoll Engineering Company?
Yeah, Jacob Driscoll is my engineer. I'll give you a little bit of history about myself and the property. I owned and redeveloped this property way back in 1990. Originally purchased from the Nabisco company, if anyone goes back that far. And over the years, we've created a nice little multi-tenant plaza with various uses, most notably White's Pastry, who we've partnered with over the years that have expanded quite a bit over the many, many years. And you probably know the plaza from along the face of the building, Giorgio's Restaurant, and there was a hair salon, which will now be introduced. A pharmacy is doing their build out at the intersection there at West Chestnut and Pearl Street. So as you can imagine, we've been managing this property, owning and managing this property for well over 30 years. And we're here in front of you today, hoping that you would consider a variance with respect to our dumpster pen in the back. We've maintained this dumpster pen again for a very long time, multi-tenant property. So we have various needs for dumpsters in that area. And as you can imagine, over the many years, it has been a struggle to maintain the swinging gates or the swinging doors, mainly due to winter conditions and the gates getting hung up and twisted and then no longer operable. And as you can imagine, with 3 or 4 different haulers that visit the site quite routinely, they don't always close the gates after themselves, leaving them vulnerable to traffic and again the winter conditions and wind and after quite an expense and 3 sets of gates, we've kept the dumpster pen intact, but without the gates so that we don't cause this aggravation that we've experienced for the vast majority of the ownership of the property. The financial hardship of those gates were somewhere around $10,000 to $15,000 each time we had to replace them. The pen has been intact. All the dumpsters are grouped together. It's on the back of the property. It does not face the street, nor is it visible from any public way. It is kept very neat and tidy. Many of my tenants have been there for a very long time. They do a great job of making sure it's clean, and between myself and the people who work for me and my tenants and my landscapers, I think we do an excellent job to make sure it is clean and tidy back there. So again, I just give you a little bit of a history of our property and what we're looking for from the board, and open to any questions that you guys might have.
Well, thank you. I believe one of our inspectors, Mr. Doucette, is on the line as well, who has been down to the site and inspected the site, and it has. Could you please, at this point, provide us the report? And
Yes, ma'am. Good afternoon. Thank you for the invitation to appear here this evening. It is true that I issued an order in March of 2022 that the dumpsters must be enclosed. Subsequent to that, I did meet with Mr. Barish and the engineering firm that he has. We discussed the matter. I do agree with what Mr. Barish stated in terms of the fact that I have never issued any violations for the dumpster areas on this property not being in a sanitary state. And I do agree that they are typically very much in a sanitary state. That being the case, they are not enclosed per the language of the ordinance. I don't agree with what Mr. Barish said that they are not visible from any public way. Indeed, this very day, I did appear at a nearby property, 1034 Pearl Street, which is on the other side of Pearl Street. And I inspected to see if the dumpsters are visible, and they are visible from 1034 Pearl Street and other addresses, I'm sure. I did send photographic evidence of that same fact to Dr. Mondesir via email this afternoon. I would contend that although the dumpsters are typically in a sanitary state and maintained well, that they are visible from the street and they should be enclosed per our city ordinance.
At this point,
So
any
that's what he's
discussion,
intending
Mr.
on doing, is enclosing them, correct?
No, I believe the variance, my understanding is that is not to replace the gates. Is that correct? Is that what is
Yeah,
being
we're
asked on the
looking to
variance?
maintain the enclosure with the exception of the gates, which is, the one side which is accessible to the trash haulers.
Madam
And-
Chair?
Yep.
Deputy Chief Williams, Brockton Fire. How are you today?
Good, how are you? Oh, thank
Good.
you, okay.
I also, I've been the proponent with the mayor's office in trying to get dumpster ordinances enforced in the city of Brockton. They seem to have lagged behind. I did go up and inspect the dumpsters today. And I would say that the dumpster enclosure hasn't been maintained. It's open on, for the most part, all four sides. I have pictures I can send. Two of the dumpsters were open today with the tops open so that animals could get into them. The grease dumpster has grease all over the ground, but they can be seen from, I'm not sure if it's a public or private way, but it's the continuation of West Chestnut Street that goes down to the phone company, or you can go into the old Bourne property there also. And if you, for these reasons, for just the fact of maintaining them, if you were to give this variance, you'd end up giving variances to another 1,000 dumpsters in the city, and that I don't think is the intent of the ordinance.
Okay, thank you. All right. Any comment from the excuse me, Mr. From the owner or the property owner?
No, I mean, we would be more than happy to make sure that whatever additional screening you need on those three sides, we would be happy to do. And as I think the board may be aware, that section of West Chestnut Street that borders my property and is the driveway to Verizon is a private way. So while it can be seen from that street, that street is not a public way. It's basically the driveway solely owned by the Verizon building in the back.
Okay, all right. You know, based on the information I'm receiving from the inspector and from the fire department, I would move that we actually not allow the variance, and pointing out that if we allow the variance for you, there are many other dumpsters in the city that would be in a similar situation. Mr. Fisk, your opinion, please.
Well, I'd like to go up and see it myself, I think. I could see any of the abutters around there, do they have a problem with it? The people that are near them, does he have any complaints or anything?
I'm not aware of any complaints against the dumpsters.
But as you said, and also Mr. Williams said that there is a problem as far as, you know, cleanliness and everything like that. And then it could open up a big door to, you know, other people around the city too.
That is correct, yeah.
Yeah.
I mean, we
It's-
haven't allowed a variance where we've not allowed, as far as I remember and being on the board, we've never allowed a variance that did not entail a full enclosure of dumpsters for multiple
think that-
reasons.
I would think that would be vital to enclosure too. So
Okay.
I think we ought to pass on it maybe.
What are you saying, Mr. Fisk? What was that?
I think we probably should pass on it for the time being anyway.
So are you saying that you want to see before making a motion? I mean, my motion would be that we
I'd
would
like to
not,
go up and see it
not-
myself, just to give them the benefit of the doubt. I'd just like to go see it myself and then maybe bring it up next meeting if we could.
Okay.
And maybe
all right.
Dr. Andre'd be here too.
Okay, all right. Because obviously, at this point, yeah, you know, I think, you know, we would not have a confirming vote without your concurrence. So, we will table this until Mr. Fisk and maybe myself can stop by and take a look at the area, and at the next board meeting, bring this up for vote. All right. Any other discussion? So we'll table the action until the next board meeting.
Thank you very much for the consideration.
Okay.
All right, thank you. And thank
Thank
you for
you.
everyone joining. Thank you.
Thank you.
All right. I guess at this point, we'll move on to the, I don't think there's any other action items. I think the rest of the meeting is informative. And
Yes.
maybe Dr. Montessori, you could lead us through information on where the city stands right now with COVID, with the vaccinations, and testing.
Yes, thank you, Madam Chair. We do have 33 cases of co-active cases or positive cases within the last last 24 hours. Those are, again, just numbers picked from DPH or Maven,
Right.
the system that collects data and spread it through different municipalities respectively. So the numbers do not reflect the specific percentage rate or a percentage that we have within the city, but today we have 33 and then 189 active cases, 32,080 cumulative cases with 502 deaths. Now, we have not lost anyone for the past month or so, but there was a reduction by in the number of cases death by 3. Occasionally, DPH would look at the would revisit the classification and redefine some pathology and remove some cases. Either they did not meet the criteria or the criterion for to be classified as COVID death, and so for that matter, they have removed 3 deaths in recent weeks. So that brings us down to 502. Now the we continue to monitor the sewer system. So we are still high. We are a little bit above, much above the median or the average as it relates to other cities across the US. So right now, today, as of, well, let me say that the sample that was collected as of Monday, which was August 29, and then the report was released today, we have 944,673 copies of the virus within 1 liter of sewer. So that tells us that people are still shedding virus, but we have a lot of people who take self-test kits,
Right.
and those numbers are not reported anywhere. So
Yep.
when we look at the numbers from DPH and then the sewer system, that gives us a closer reflection as to the percentage. So we are about 6.7% of the positive rate within the city.
Okay.
Yes, and as it relates to vaccination, I think that's one thing that we continue to do. Yesterday, we had a vaccination clinic at the Adult Haitian Daycare Center on Center Street, and the public health nurses vaccinated 56 people for COVID and 27 doses of our flu vaccine. On Tuesday, they were at the Shaw Center also, and they have very low number, but they continue to go there. They have another vaccination at Farmers Market, which is around City Hall, and that continues probably until near the end of October. Booster is also at the Shaw Center every Saturday. And that is going well. The numbers sometime in the 40s, in the 50s. So they're encouraging because we still have people coming to get vaccinated. Also, a great news. I've been reporting to the board that we've been working to get a company to do PCR testing for us. Well, it has come to flourishing. Today is the first day of curative ink at the Shaw Center. They didn't have that many cases for the first day, but tomorrow, the mayor will hold a press conference there at 3:30 at the in front of the trailer, the curative trailer. And so we will have some media outlet represented also, so that they could help to promote the testing.
Great, wonderful. Great. So thank you for that. Any word the newer vaccine, the newer booster shot that should be released shortly that covers the newer variants? My understanding is going to be released very shortly. So, but any word from the Department of Public Health or from when it's going to be available within the city for those that need?
Yes, we are expecting to get the release probably within the next 2 weeks. And so DPH is asking municipalities to start applying. We will be applying probably in the coming days or this week.
Okay, wonderful. Good.
Yes.
Great. So it's a separate application to receive that vaccine. Is that correct?
Correct.
Okay. All right. So, okay, very good. And as you said, the numbers probably in the sewer reflect better what's going on in the city, and we are above median for the rest of for other municipalities in the country. And you're right, the home testing, a lot of folks are doing home testing. So what we're getting probably from the Department of Public Health is an underestimate of the degree of the viral load within the community. So hopefully it seems like we're in a little bit of a down. It's trending slightly down from where it was a few weeks ago, but we'll keep an eye on it at this point. So
yes.
It's great to have the testing up at the Shaw Center. So thank you for that. Next time is also
I have one question too.
Go ahead, Mr. Fisk. Yep.
Yeah, I have one question. In regard to the statistics that you were saying about the people, in the area that do have, the virus and everything, is there anything kept about these people? Are they people that have already been vaccinated and maybe have boosters and are still catching it? That's one question. Then I also have a question. Do you find that the people that are getting it, their symptoms are a lot less than they used to be, say a year or two ago, type of thing? Do you find that it's not quite as bad There was just two questions. I don't know if there are any statistics in regard to that of people catching it that, still are vaccinated and boosters. You find, you see people still getting it. You find that these people that you're talking about were they vaccinated and have boosters and still got it? And then also, is it a lot, less severe?
Oh, well,
go ahead, Mr.
Go ahead. Go ahead, Dr. Murphy.
No, I was going to say that, it's clear that, yes, people who've been boosted and vaccinated can catch it, particularly with the new variants that are out there. The issue is that what we're seeing is patients who are vaccinated and boosted have much milder. So we're not seeing the same situation as we do for unvaccinated. So you're far less likely to die, far less likely to have serious disease, far less likely to wind up in the hospital if you are boosted and vaccinated. And, the medications that we have right now, the Paxlovid and other medications that can be used, we clearly, can patients who previously would move on to have serious disease, we're able to keep them from being from developing serious disease. So vaccinations has made a huge difference. Boosting is important, and that with the new vaccine coming out, the hope is that will stem some of the infections that are going on right now related to the new variants, because people who are boosted and vaccinated are getting the new I would say we're seeing more of them come down with COVID at this point that have not been infected in the past, often with just mild disease, and again with the treatments often not coming into the hospitals, but definitely despite being vaccinated and boosted, you still can be vulnerable to the virus, but a much milder disease when they occur. So.
Well, that's good information for people that might be listening.
Yeah. So, and we'll see that with the newer variants. The nice part of the newer type of vaccines that are out there is that they can be adjusted much more quickly to the variants that are out there. The other thing that you brought up, Dr. Montefiore, is that you have flu vaccinations going on as well. Is that correct?
Yes. Because of the amount that we used last year, so we had a limited number that we could order for the first time this year from DPH. They delivered 220 doses, and then we purchased 50 doses. So that brings us to 270 doses altogether. So right now we have a clinic set up in October with Council on Aging, but we are planning clinics at the City Hall for the employees, and then distribute vaccines also in some other cases, maybe at the high rises for the elderly. And what that means is that more we use, more we can reorder. So we are looking to do as many vaccination clinics as possible, so that we can apply and get more and get the people the vaccines that they need.
Yeah, and it's a good opportunity because when you're doing the flu vaccines, you can also be doing boosters at the same time. So it'll be important. As we routinely open our our flu vaccine clinics, to be able to provide the boosters as well when those clinics open, and to the various locations that you do go routinely to give those to have those flu vaccination clinics. So, and that's usually so hopefully we can do both at the same time and get as many people vaccinated as possible. So. Any other discussion? Okay, so next time on the agenda is the mental health needs within the city of Brockton. So you've been reaching out to the state and other local partners. Would you like to fill the board in on what's been happening in that regard?
I have been attending the behavioral health task force very regularly, and I'm in touch with also with the regional mental health department for the southeastern region, and also given that I also have a hat, or I have a voice statewide at the state Department of Mental Health statewide advisory council, so I'm able to interact and see how we could really address it. And I must say that things seems to be moving positively for us, for the city. And as a matter of fact, among the speakers that I have secured for the symposium, which I'll talk about in a little bit also, is the Commissioner of Mental Health, Commissioner Brooke Doyle. So she will be presenting also at the symposium on September 24th. So I think I find that a positive outcome. I mean, a plus
Yes.
for the city, and I am encouraged by the inroad that we're making.
Great. Wonderful. So any questions on that, Mr. Fisk? Or
None here.
done here? So maybe you could fill us in then on the symposium. It sounds like you're putting together a planned meeting symposium for the city and to discuss sort of lessons learned over the past couple of years. So sounds like an exciting and what's going to be a very informative day. So maybe you can fill us in on what arrangements you've made so far and what's being planned for the day. So.
Thank you, Dr. Brophy, and thank you, Mr. Fisk. We've been working, my team has been working very diligently. We meet every Wednesday afternoon at 2:30 here to plan it. This week we had a few people out, some of them sick, some of them had to attend some training, and we had the nurses at the clinic. So we moved the meeting from yesterday to tomorrow. But we are planning to have the symposium. Basically, the symposium will have two sections. The first section, which is basically a health fair. And I thought that after COVID, it would be a good idea to bring some health service providers together in one place and have the residents, the people in the community come to get screened for some certain issues, health issues, or maybe get some information. So for that matter, I have been reaching out to different vendors, different providers, the hospitals, DPH, the clergy, dental department, or dental service providers. So we are making inroads. Among participants, we have the police department that will be attending as well, and that will speak as well. Worcester Ambulance, because they have been very active. And in fact, with respect to emergency responses, there are three particular groups that come together to help meet the need. It's the police, the fire, and the emergency EMT. And we are fortunate that we have Worcester Ambulance in the city that works very closely with the city. So they will all be speaking. On top of that, we have BEMA with Steve Hook, who's the director of Brockton Emergency Management Agency. He will be speaking also. So basically, I give you a broad scope of the day, but there will be the first part, which will be health fair from 9 to 12, and then from 12 on, we will transition to the symposium, where we'll have speakers and on different topics, different areas as time allows, and then we will have a question and answer. Maybe for the remainder of the time, half an hour, 45 minutes or so.
Wonderful. Sounds like it's really has come together. You've got a number of great speakers, and really reflecting back on lessons learned of the past 2 years, but also talking about how sort of bringing together the health community within the city, and talk about how we can move forward to build a healthier community is a nice sort of time to sort of step back and do that. So I really appreciate that you're doing this, and that the department now. I know you've been overwhelmed over the last, particularly last the the last couple of years. But now coming out of it, out of sort of the urgency of the pandemic, and now stepping back to saying, getting back to other public health issues within the city is important, and it is a time, I think, everyone in the healthcare community to reflect back on what we did well, but also what we did not do well and how we can do better moving forward. So I applaud you and your department for putting this together. It's a great idea, and look forward to the meeting. And that meeting is planned. Is the date set now? It is September 24th.
Yes, ma'am.
Or
Yes.
yes. Yep.
September 24th.
You're going to broadly spread the word about the symposium and use your various a number of channels for communications that have been set up with COVID, the various community groups, et cetera, that have worked with us to clearly make them aware of what's going on, and hopefully there'll be a good open period at the beginning for folks to come in and learn, interact with all the health providers within the city, and then look forward to the symposium in the afternoon. So thank you for putting that together. Mrs. Fisk, any comments or questions about the symposium?
No, nothing here. Where is the
Great.
meeting going to be?
It's going to be at the Shaw Center. Yes. Yeah. I know you know where that is.
Yep. Certainly do. And what time is the meeting?
Well, the day will start at 9 o'clock, but the first part, there will be a first part for services, for health providers to provide some services. That will run up to 12. And then the second part, which is the where we have the speakers, that will go from 12 to 2:30.
Okay.
Wonderful. All right.
Thank you.
Great.
Thank you. Thank you.
All right. So next item on the agenda, I will, I guess there's a couple of miscellaneous items. So we've had one confirmed case of monkeypox within the city, and another case that we redirected to another municipality. Is that correct?
Yes. DPH did inform us of one case and then added another one, but then the first case that was reported to us, that was confirmed and reported to Brockton, is a case that the person traveled overseas, but apparently just before traveling overseas, the person has changed city of residency, and so therefore the person was infected while abroad, and seemingly because the person originally lived in Brockton, so it was first reported to Brockton, but then redirected to the other city, which is Acton, where the person has moved to just before the trip.
I see. So it's only one case, but it was a person who lived in Brockton before, and when reported to us, it actually has changed residency to another city. Okay, great. All right. And I know for folks interested in vaccinations about monkeypox, that the state has a number of places that are in place for those vaccinations. I believe Randolph is the closest to the Brockton area, but there's a website on the Department of Public Health that folks can be directed to if they're looking for vaccinations. So, and have people been calling or asking about it, or calling the board regarding this, or
we have a few callers asking if we have cases in the city, so we let them know, and we also inform the other service providers, because the mayor has a meeting that is ongoing with the area hospitals and Brockton Neighborhood Health Center, Father Bill's shelter, and also there is a representation from Senator Brady's office. So we talk about it every month, at least once a week. And so we keep it up. And then we have the latest information that we're going to be posting on the city website for additional information. Probably that will be posting within the next 24 to 48 hours.
Okay, wonderful. So, any questions, Mr. Fisk? Or?
None here.
Okay, great. So last time on the agenda, I guess the governor signed an order saying that we will be extending remote meetings at least until March of next year. So next month's meeting, again, will be a remote meeting. And the plans for next month's meeting would be October 6th at 4:30, our usual time. So any other items or issues for discussion?
Nothing here.
So with, so Mr. Fisk, a motion to
I'm making a
adjourn?
motion that we adjourn until next
All
month.
right. All right. So thank you again, Dr. Montessori, and thank your department for their great work. And we'll reconvene in October.
Thank you so much. Thank you so
All
much.
right.
Thank you.
All right.
Keep up
You
the good
take care.
work.
Thank you very
Okay.
much.
Bye.
Bye-bye now.
Bye-bye. Bye-bye.